Hello, I'm Dr. Doug Broman of Broman Chiropractic and Wellness in Maple Grove. Today, I'd like to talk to you about traction and decompression. In traditional chiropractic, the main therapy that we provide is chiropractic manipulation. The purpose of a chiropractic adjustment is to relieve the pressure on the nerve to help the body heal from within. Oftentimes, problems are complicated by spinal degeneration. Spinal degeneration is a natural process that occurs during the course of a lifetime. Normally, the discs of the spine are nice and thick and supple and provide ample space for the nerve to exit between the vertebrae. The disc is a unique structure in that it's avascular, meaning that it does not have a blood supply. So it's utterly dependent upon the body's hydration to maintain its flexibility and height. Over time, what we see is spinal discs tend to thin out and dehydrate. This resulting in nerve compression by the narrowing of the opening where the nerve root comes out. Here's an example of advanced disc degeneration. As you can see, the opening between the vertebrae is very small. And that opening is important because that's where the nerve travels from the brain and the spinal cord to the nerve root. These nerve roots travel from the neck into the arms and from the lower back into the legs. We commonly incorporate spinal decompression or traction to assist the chiropractic adjustment in relieving the pressure on these nerves. Specifically in the cervical spine or the neck, spinal disc degeneration results in numbness and tingling in the hand, weakness in the hand, and pain. The purpose of decompression is to actually take that disc that is degenerated and separate it by exerting traction and axial decompression. This pumping mechanism relieves the pressure on the nerve to give that nerve a little wiggle room so it can breathe and function normally. In the lower spine, we see disc degeneration resulting in sciatica or numbness and tingling in the feet or legs, often resulting in neuropathy, weakness, pain, and muscle spasm. Again, in the lower spine, we commonly see disc degeneration, not a whole lot different than what this model is displaying. We have specific techniques called lumbar decompression that actually separate the disc and allow that nerve to breathe. When combined with chiropractic adjustments, spinal decompression can really enhance the recovery of nerve entrapment, resulting in spinal disc degeneration. As I noted previously, the process of spinal disc degeneration occurs over time, resulting in a narrowing of the space between the vertebrae, causing compression on the nerves. Here is an example of a lumbar disc herniation combined with degeneration. We combine chiropractic adjustments which relieve the pressure on the nerve by restoring motion and alignment to the vertebrae. Today I'm going to demonstrate lumbar decompression called Cox flexion distraction, where we will separate the vertebrae and the disc, relieving the pressure on the nerve. This is accomplished by identifying the level of the spine nerve degeneration and the spinal disc, applying pressure to the vertebrae above, and then drawing pressure down by using the weight of the legs and the lower body. This table is specifically designed for this purpose. So we isolate the vertebrae above the level of the disc, and then we exert a downward pressure. Imagine the legs and the lower body and the weight of that pulling that disc apart. We do this multiple times, allowing the disc to be decompressed, relieving the pressure on the nerve. Similar to traction, Cox flexion distraction actually isolates the specific level of the disc and stretches that disc out to alleviate the pressure on the nerve. In the low back, we see this effective with facet syndrome, where you develop arthritis in the facet joints, lumbar disc degeneration, where the disc has thinned out over time, resulting in nerve compression, and even with disc herniation. Oftentimes, we'll actually isolate the side of the disc and laterally flex the table away to open up that narrowed nerve root even further. So again, this is a process of spinal decompression specifically applied to the lumbar spine in conjunction with chiropractic adjustments to restore function, mobility, relieving the pressure on the nerve, allowing the body to heal naturally from within. Once again, my name is Dr. Doug Broman from Broman Chiropractic and Wellness. If you've been suffering with problems related to arm pain, numbness and tingling, leg pain, sciatica, muscle cramps in the legs, try chiropractic adjustments combined with spinal decompression to assist you to restore your health so that you can enjoy life and live well. Have a good day.